Moving on from the legal side to the cultural side, my pleasure to welcome Dr. Dan CARUCCI, who's a global medical director at McCann Health, to talk about cultural insights to increase vaccination uptake and compliance. Welcome, Dan.
Thank you. Hi, everyone. First, a big thanks to the National Academies of Sciences for the kind invitation to speak about some of the work that we've been doing at McCann Health and how we're looking to find creative solutions to increase vaccine uptake as part of our commitment to global public health. For those of you who may not be familiar, McCann Health is one of the most creatively awarded health communications agencies. In addition to our work supporting our private sector clients, we've made a substantial commitment to bring our expertise in marketing and advertising to increase the impact of global health investments through effective and creative communications. If I could have the first slide, please. So Dorit and Michelle spoke of some of the incredibly important legal approaches to promoting childhood vaccinations. I want to describe some of the work that we've been doing on the demand side of the equation to develop creative ways to drive vaccine uptake in underserved and underdeveloped parts of the world. The project I'm going to be speaking about today is really incredibly simple, and it began while we were working to support the Afghanistan Ministry of Public Health through a UNICEF program to assist in improving health communication strategies across the country, and while I was working in Kabul. Next slide, please. Next slide. I certainly don't have to belabor the point, but of course, childhood immunizations have been responsible for saving the lives of millions of children and are arguably one of the most powerful and effective health interventions we have to reduce childhood mortality. Yet, as we know, far too many children don't receive the vaccines they need or don't complete their vaccine schedule. Next slide. So why is this? Well, of course, in many places in the world, despite the efforts of governments and supranational organizations like UNICEF and Gavi and others, which have made clearly dramatic progress in improving vaccine access, supply chain and distribution chain problems, logistics, and other technical barriers mean that vaccines are not available when and where they should be. So this is an important element of why many children don't receive the vaccines they need, is lack of access. However, even where vaccines are made available, far too many mothers don't make them a priority for their children. Perhaps this is because of myths and misperceptions or ignorance or indifference. For these reasons, they don't bring their children to vaccination clinics appropriately. Next slide. So the question is how can we increase the perceived value of childhood vaccinations for young moms? For moms who struggle with many life stresses and priorities, vaccines are often not a priority. How can we increase the demand for vaccines where lack of access may not be the primary factor for poor uptake and compliance? When moms have to decide to take substantial time or resources out of their day to travel to a vaccine clinic, how do we place childhood vaccines higher on their list of priorities? And how can we drive home the message in an emotional and compelling way that vaccines are needed to protect our children from serious illness so they grow up to be strong and healthy? Next slide. So this little bracelet is a common sight in South Asia. Mothers and grandmothers provide them to their young children in early infancy as a symbol of protection against evil forces. A nazar or evil eye is sometimes included on the bracelet, which is an additional symbol of protection. This practice is widespread across socioeconomic levels, particularly in South Asia, but also in many other communities, including in Africa. Next slide. From wealthier families, next slide, to the poorest of families. Next slide. So we decided to harness this ancient, deep-rooted traditional belief system that a simple bracelet protects against evil forces and create a bracelet that has the potential to increase vaccination uptake and compliance. We do this by associating the bracelet, a powerful symbol of protection against unknown forces, with the protection that's afforded by vaccines against serious diseases. Next slide. So this is the immunity charm, a very simple idea. A bracelet with a screw closure, an evil eye, and colored beads that represent each of the vaccines a child receives at immunization clinics. Next slide. Each bead is code for a specific vaccine. When a child comes to the vaccine clinic, the corresponding bead is added to the bracelet. And in fact, the immunization history of the baby is worn by the baby. Each colored bead represents an additional level of protection against diseases as individual vaccine doses are given to the baby. Next slide. So we conducted a small qualitative project in Kabul to gauge the acceptability of the bracelet among healthcare staff and mothers attending a vaccine clinic. Next slide. We found that the bracelet was readily acceptable to mothers and healthcare workers at the immunization clinic. In fact, we actually had a hard time keeping the inventory secure as the bracelets were so popular within the community. Next slide. The overall response from both moms and healthcare providers was overwhelmingly positive. Next. Healthcare workers actually talked about how they saw the immunity charm as fitting within the existing traditional belief systems of the community and felt confident that the bracelet could drive greater appreciation in mothers for vaccines and the protection of their children. Next slide. In fact, when I spoke to one healthcare worker, he remarked that moms in the waiting area were all talking about which colored bead represented which vaccine. Is the red bead measles? No, the red bead is polio, etc. And remarked that they had never experienced moms talking about vaccines in this way, in such a tangible way before. Next slide. So we see the immunity charm as a potentially powerful driver for improving uptake in vaccine compliance in particular communities where this tradition is widespread in at least 3 important ways. We think moms will see the immunity charm as a symbol of protection against disease in the same way that they see other bracelets as symbols of protection for their children. The bracelet will be a symbol to others in the community for the love the mother has for her child, and will increase the perceived value of vaccines among mothers. Secondly, it will also provide a visible symbol to other influential mothers and community members to encourage childhood vaccinations, perhaps leading to encouraging moms who have not yet vaccinated their children that this is an important health intervention that they should seek for their child. And third, finally, the immunity charm, we think, will provide ready visual indication to healthcare workers about the immunization status of their child. Although importantly, we don't intend that the immunity charm would represent a replacement for the standard immunization card. Next slide. So a very simple idea. We still need to generate the data to demonstrate the effectiveness of the immunity charm in the field. Qualitatively, we're confident, but we need the quantitative data. Our plans to launch a quantitative effectiveness study in one state in India were unfortunately put on hold due to the pandemic, but we hope to restart those efforts in the near future. And so with that, I'll close and look forward to questions in the Q&A session.